So we will now be starting chapter 8. We will have the midterm before we have the test over chapter 7 and 8. So the midterm will include chapter 8, but not chapter 7. So make sure that you study this thoroughly and take note of the cardiac-related questions or cardiac-related subjects on the midterm study guide. So chapter 8 concerns the cardiovascular system, and anything that affects the cardiovascular system can affect the kidneys and vice versa. So we sort of study those together. So in chapter 8, we'll be talking about the textbook pages 125 to 157 and ATI chapters 18, 19, 20, and 21. So make sure that you read those pages and look at the practice tests in the back of the ATI chapters, as well as the learning outcomes and key terms on page 125 and 126, and the key points at the end of the chapter. So we'll start off talking about diuretics and drugs that affect the kidneys. And so whenever we're dealing with a diuretic, we're talking about a drug that is made to help the body get rid of excess water. And the diuretics we'll be talking about produce a loss of sodium. They make the kidneys get rid of sodium rather than pulling the sodium back up and returning it to the bloodstream. So we know from what you've learned before that water always follows sodium or salt. So anywhere your sodium goes, your water is going to follow. So if you get rid of sodium, the water will follow, and not having as much fluid in the bloodstream sort of releases the pressure of all that fluid inside the arteries, and so that sort of leads to a reduction in blood pressure by not having as many fluids passing through the bloodstream. So we'll be talking about 3 categories of diuretics. We're going to be talking about thiazide and sulfonamides, and they are related to each other. We'll talk about loop diuretics, and we will talk about potassium-sparing diuretics. So on pages 126 to 130, we talk about various kinds of diuretics that indirectly lead to blood pressure reduction. And many times doctors will prescribe not only a blood pressure medication, but also a diuretic to get rid of extra water. So all of these work by getting rid of sodium. Along with the sodium, of course, follows the water, but with the sodium and water, you also get rid of chloride and most of the time potassium. Now the difference in the thiazide and sulfonamide diuretics is that while they get rid of sodium, water, chloride, and potassium, they reabsorb, they promote the reabsorption of calcium. So the kidneys do not filter and take up salt, which is sodium and chloride, water, and potassium, but they will take up the calcium that has circulated through the kidneys and return it to the bloodstream. So the thiazide and sulfonamide diuretics are considered to be really good for elderly patients because all elderly patients need calcium to prevent osteoporosis. Now our prototype drug that we're going to talk about is a drug called hydrochlorothiazide. Sometimes you'll see it abbreviated HCTZ or hydrodiuryl. And it's well known for it getting rid of both salt and water as well as potassium, but keeping calcium. Then we have a category of diuretics called the loop diuretics. And the reason they call them the loop diuretics is because they work in the loop of Henle. They've got the kidneys have a very intricate collection of tubules that kind of go up and down, and in the pictures, and there is reabsorption of various substances throughout these loops. And the loop of Henle is where a lot of the transfer takes place when you're talking about loop diuretics. So the loop diuretics also cause loss of sodium and chloride, which is salt. They cause the body to get rid of excess water because water follows salt, and then potassium goes along with it. The prototype loop diuretic is a drug called furosemide or Lasix, very commonly used for a long time. This is very good for patients who have kidney disease. If there is a certain amount of kidney failure, the glomeruli of the kidneys do not filter as well as they used to. For instance, a condition called nephrotic syndrome causes very low GFRs, glomerular filtration rates. And so these loop diuretics are easy on the kidneys of somebody with their nephrons being affected. Congestive heart failure and cirrhosis, both of which cause a lot of fluid buildup. Basically, any kind of kidney disease where you need a really powerful diuretic, the loop diuretics are very good ones. Furosemide or Lasix is our prototype. There's also one called Bumex that requires a smaller dose and is still very effective. The last diuretic that we're going to talk about, or category of diuretic, is a category called the potassium-sparing diuretics. So where most of the diuretics get rid of salt, sodium chloride, water follows, they also get rid of potassium. However, these potassium-sparing diuretics, rather than getting rid of the potassium and having it flush out with the urine, they take it back up again, they filter it back up into the bloodstream. So our prototype drug is a drug called spironolactone or aldactone. This has been on the market for a long time. They started using it in 1959. It's not the greatest diuretic in the world, but it's good for people who have kidney conditions that can cause hypokalemia, where the body gets rid of too much potassium. So a potassium sparing diuretic will get rid of the salt, will get rid of the water, but it will hold back on the potassium and return it to the bloodstream.